decisions, you should go ahead and put this in writing, like a will or something like that. This is what I'd like to happen. I'd like for my oldest son to be responsible for making decisions about what is to take place.
Okay, actually, yes, that's clear for me, but that task number 2, the patient must have the capacity to understand the implication and consequences of appointing MPOA. So I should explain for him what's the implication and consequences. What will happen if there is medical power of attorney? And actually, I don't know.
That's what I just said. A medical power of attorney. Well, first, if I did not have a medical power of attorney, I can come to the doctor and say, this is what I want to have done. And you'll say, okay, I'll run some tests and we'll see if you qualify for this, or no, you don't qualify for this. Do you understand that?
Okay.
Okay. Now, if someone has the medical power of attorney, that person could go to the doctor, could go to you and say, I'm concerned about Priscilla. She's acting strange, and I think she should be put into an institution. Then you would say, well, I agree based on whatever. Then you'll sign the papers, and then they can take me on to the institution. But in terms of what you are answering, the only thing that you are responsible for knowing is that you should be able to tell the patient, it is your decision as to whether you want this person to be your medical power of attorney. And if you go ahead and say, yes, I agree with you, your mom is kind of crazy or sick, I'm going to sign these papers. Implications for you is that you could lose your license because you falsified some documentation. The response is going to be the exact same as it would be if that person, I don't know whose thing was that the patient wanted to take 2 weeks off and go on vacation. And this person wanted the doctor to give him some type of medical leave. That is illegal, and that's falsifying information, and you could lose your license for doing that. The only thing that a doctor is supposed to do is write prescriptions, give diagnosis, and make suggestions. Now, do you understand that part? Yes or no? Do you understand that part? So Sarah, I'm waiting for Sarah to come back on. For some reason or another, I think we got disconnected. Nabila, are you there?
Yes, doctor, I'm here.
Okay, so Sarah apparently got disconnected. So I don't know, but anyway, did you have that question, or was that Sarah as well? Where the patient?
Yeah, you can continue.
Was it the patient that wanted to? The patient wanted to go on vacation. Was that yours or was that Sarah's?
I think Sarah.
Okay. All right. So
we can start to write PDF. She wants a PDF for this case.
Okay. Well, no, I'm not going to write the PDF without her. So I'll just go ahead and go to yours, Sarah.
Oh, mine.
Okay, I found you. Let me find yours. My drive. I put them in my drive. And Nabila. Okay. So let's see. Can you see my screen?
No.
No. Okay. Nabila. Okay, so Nabila, here is yours. That's 60, 56, and 50. Which one would you like me to start with, Nabila?
50.
Which one? 60, 56?
60, yeah.
Which one,
This
Nabila?
one, 60. 60.
Okay. Sarah, could you mute your microphone?
Yes, okay.
Okay, thanks. Okay, so this is the doctor's role. The doctor is to ask the patient if she has any questions about dementia. Generally, if the patient is familiar with,
Which case are you discussing, guys? Sorry.
this one is 60, 60.
60? Okay.
60. All right, so read the task for me, Nabila. Read the task for me, Nabila.
Okay, ask the patient if she or he has any question about dementia generally, and if the patient is familiar with the symptoms of Alzheimer's.
Okay, continue all of it.
Discuss the possibility that patient may be experiencing other forms of depression. Pursue the patient to see clinical neuropsychiatrist, psychologist before considering having genetic testing, and explain the reason for this. Formal cognitive evaluation and assessment of the possibility of depression as a component extra, and explain that prior to any future genetic testing, the patient will need to have specialty genetic counseling, counseling from health professionals with specialists training in genetics and counseling to consider possible outcomes of the testing.
Okay. Now, do you want me to be what? Do you want me to be the doctor?
Yeah, it will be better.
Do you know what your role is as a patient? Do you know what you need to know?
Yeah, I have a card here.
Okay. So as I'm here, you are my patient, but I'm seeing you for the first time. Okay. That's what I'm thinking. Hello, you know that same old routine, right?
Yeah.
Okay, so I want you to tell me why. I'm going to say, tell me why you want early retirement. Why do you want early retirement? Why do you want early retirement?
Yeah, because nowadays I was finding difficult to manage my workload, and I am concerned about Alzheimer's disease because my father and older sister have the condition before.
Okay. So what do you know already about Alzheimer's?
Actually, I am familiar with the symptoms of the Alzheimer because I told you my father and my older sister have the condition, so I am familiarized with the symptoms well. But right now, I would like to do genetic testing because I have a family history of Alzheimer.
Okay. What I would like to suggest is that we start with whatever that thing is. Start with NEWROSPYSCHO, serological testing. Okay. What might you say?
No, I don't think it is neurological test. It is a clinical. It is doctor. It is a doctor. He recommend the patient to see the clinical neuropsychologist. It's like psychology. He's a
Okay.
doctor.
Okay. Well,
Yeah.
start with the CLA. It's clinical neuro something.
Okay.
I may be spelling it wrong, but what I'd like to suggest is that we start with the clinical neurological testing. Okay.
Okay. No, no, doctor. I don't want to see a neuropsychologist first. I want to do the genetic test. That I want first.
Okay. I can understand that you would like the GE, well, genetic something, whatever it is.
Counseling. Okay.
However, no, well, no, this is, however, before you have to have, as I'm understanding, you need to have this thing first. However, before I can do anything else, before I can do anything, before I can do anything else, you will need to have genetic counseling. So you're in the CLNG. Let's see if that's what you wanted. Okay.
Mhm.
Explain the. So before I can do any genetic testing, you will need to have the specialist counseling. Okay. You want me to give you something right now. You want me to do something now, but I can't do that something right now. State that you're familiar with the symptoms. Be surprised that a little friendly when there are possibilities of impaired cognitive performance. Hey, don't forget that you were supposed to have cognitive performance. This is one of the reasons why I suggested that you write down these things. COUNSC. Okay, before I can give you anything, you're going to need to have the counseling. All right. It's now Shady just left. Nabila, Sarah just left. I needed to ask her. All right, let's just go through this. I don't think this is helping you. I don't think that this is helping you. But when we have Sarah, is Shady coming today? Sarah, is Shady coming today?
Yes.
Okay.
Yes, exactly. He is preparing, just preparing.
Okay. So we're already into the first 20 minutes. So the task is that you are, as a patient, you need genetic testing. You would like to have some genetic testing. So let's just go down here, patient, and we're going to say, let's just start here. I would like to have some genetic testing done. I understand you would like to have genetic testing. Could you please tell me more about this? Doctor. So we're going to go back up here. Say that you're familiar with the symptoms. And I am familiar with the symptoms of dementia and Alzheimer's. That is great. Now, I need to explain what should take place first. And the first thing that we need to do, we need to persuade the patient that to see me before considering having genetic testing. Okay, so before I can do anything further, I will need to have an evaluation from a genetic counselor. Patient says, I am very familiar with blah, 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 because family members, blah, blah. Do you understand so far?
Yeah.
Okay. Okay, so I'll persuade the patient considering her formal cognitive evaluation. Okay, there. And then, and you're just telling me I don't need the SHM. I am, it is my responsibility to have valid reports on the patient. In this case, the patient is you. Once you have the whatever GENET evaluation, I will be able to diagnose blah, blah. There are many causes of, what was it, stress? What else were you having? Stress?
Doctor, I think the task was different. I think he is, I need to exclude some condition before going to genetic counselor. And what you have written down that he is, that's the doctor need to do genetic counseling first.
Okay, so again, Nabila, this is why I said that you should write down what the doctor should be saying. Then
Yeah,
after I see what you've written, what the doctor is saying, then I can correct it. Because right at this moment, I don't really know what the doctor should be saying. I'd really
actually the in this case, actually, doctors are just first going visiting clinical neuropsychologist, but the patient refused. So doctor tell him, okay, before doing genetic testing, try to see genetic counseling first to give him idea about the test outcome. It will help him to diagnose Alzheimer or not, like this.
Okay. So why couldn't you write that down? Why couldn't you not write that down?
Okay, I will try after the class.
Okay, because I'm going to tell you that the time that it's taking me to go back and forth to read this and put something where it belongs, if you know what you're supposed to say, you just don't know how to say it. I don't even know what you're supposed to say, not to even mention how to say it. But once I know what you're trying to say, I can help you to say it better. Okay?
Okay.
All right, so let's look at the one for Sarah. All right, Sarah, I
Yes,
think the same situation is going to be with you as well, but we're going to go ahead and take a look at.
Yes, I can, as you gave an idea before, I can practice this case as a doctor and you are the patient, if you don't mind.
Yeah, but okay. All right, let me just go ahead and get to yours. And Sarah. It's not serious.
Case number 41.
Okay, so Sarah, here's the patient. Okay, you know the doctor's going to say something. You know the standard. Is that what
Yes.
doctor, patient? Then the doctor says what? What's the first thing the doctor is going to say? I'm looking at your chart. From your chart, I can see. What is the doctor supposed to be doing?
Okay. Hello, I'm Dr. Sarah. I will be the treating physician today. It's very nice to meet you.
Go away. Cancel. What happened to my document? I'm Priscilla. What are you going to say next?
Yes. Thanks for coming in, Priscilla. Did I pronounce your name? Okay, that's enough. Thanks for coming, Priscilla. Today, as I'm looking at your chart, I can see that you are here today to discuss something related to medical power of attorney. As I'm looking at you, doctor, okay.
Yes, this is the correct. I'm concerned about the MPOA. My son wants to be my MPOA, and I don't think it is necessary.
Thanks for sharing your thoughts. No, sorry, I rephrased first. Okay, so your son wants to be your medical powerful attorney?
Yes.
Okay, I can see. Let okay. Let me ask. Okay. I know it's totally difficult for you. It is not easy for you to have. I don't know what I should say, doctor.
Okay.
What how I should show empathy.
So you are, okay. I can understand your concern. Do you believe you need a MPOA at this time?
Okay, I can understand your concern. Do you believe you need MBO at this time?
And the patient says no. My son is insistent that he become my MPOA. And I don't know how to tell him it is not necessary. What should I do? Okay.
Yes.
Right?
Thanks for asking, Miss Priscilla. Thanks for asking, Miss Priscilla. I believe that that's not necessary at all to appoint someone to be MBOA. And if you want to, and it's okay to choose who will be your MBOA.
Forget what that thing is, putting writing your management plan. You need to go ahead and put an MPO in place.
Doctor, I think Miss Priscilla, it's at this time it's not necessary for you to choose an MPOA. I think we shouldn't add this. I think this is answer for another task. So I think let me assure you that you can choose anyone else than your son to be your MPOA. Do you know?
That's correct. So there again, the same thing that I'm saying to you is what I was just saying to Nabila. You know what you should be saying. So here you could say, whatever you just said. Whatever you just said. Tell it to me again.
Yes. The task was talking about that is not necessary to appoint a MPOA, and she can appoint someone else than her son. So as you write down, Mrs. Priscilla, at this time, it's not necessary for you to choose an MPOA. And in addition, you don't have to choose your son as you can choose another one to be your MPOA, but I think there is more gently way. I shouldn't accuse her son.
Well, we weren't. I don't think I was just accusing. Yes, you can choose the person of your choice. I think it is her son that says. I thought I read that somebody has said that they want to be it. Whoever it is, it may not be her son. It may be her daughter. Someone. Your son wants to become your medical power of attorney. Someone who makes medical treatment decisions for you, and you lose the capacity. You lose the capacity to make those decisions yourself. You have never been very close to your son who lives interstate. Your spouse died 3 years ago. You feel under pressure and seek advice from your doctor for appointing a medical power of attorney. So here, my son is insistent that he become my MPO, and I don't know how to tell him it is not necessary. What should I do? Ms. Priscilla, at this time, it's not necessary for you to choose an MPO. Let's take that out, and you'll say, "Is that right?" Yes, you can choose a person. You can choose the person of your. You can choose anyone to be your MPOA. Okay. Now what?
Okay. So I will say that let me explain for you what is MPOA, what I should do. I don't know. Please,
Okay.
could you take yes? Could you take a look at the second task because okay.
MPOA. Okay, what is MPOA? Doctor and MPOA is a medical power of attorney. This means that the person, MPOA, can make any medical decisions about you. Okay. Now let's go back to see what task 2 is.
So my son, doctor, is insistent to be my MPOA without my consent.
Okay. Is it possible for my son to become without my consent? Doctor. No, it is
Okay.
not possible for blah, blah, blah. However, it is important that you create a management of care plan.
Yes,
So,
advanced care plan. Yes.
so that when the need arises, you will have something of care in place. You will have a plan.
So, doctor, but I still need to tell you that is the last two line. It is not in the right place because this task is talking
Okay,
about.
so
I
Nabila,
will try to. Okay.
I mean not Nabila, Sarah, the questions of these things in this order, they may not come to you in this order because of the way the patient may ask you. The patient may ask you something here, and your first response might be here or here. But
Okay.
you
What
shouldn't.
I'm should try to cover. That's the point that
Okay.
I should explain for him that MPOA will lead to that you it is a process or approach. I don't know. It is that enable the patient the another other one to take his medical decision. However, there is no euthanasia or refuse palliative care. So do you get my point? I will try to in this
Yeah.
point I should
Okay.
explain the patient that MPOA not danger his life, and there is consequences also that he will not able to take his medical choices.
Okay. So somewhere in here we could say, and this means the MPOA can make any medical decisions for you. For example,
Doctor, please check the tasks, because if you read the tasks, it will be more easier. You will
I
have
did.
the thoughts directly.
I did. It's this one right here. Reassure the patient that he or she will be supported during the illness. MPOA cannot arrange euthanasia or refuse palliative.
And the task before, please.
Provide reassurance. No one can appoint themselves as MPO for another person. The patient must have the capacity to understand the implications and consequences of appointing an MPO. Otherwise, it is illegal. It is not legally valid. I think that this is here, right here. This is what I'm saying. Thanks for coming. Yes, this is great. I'm concerned about this MPOA. My son wants to be my MPO, but I don't think it's necessary. Can you tell me more about it? Okay, so I can understand your concern. Do you believe that you need an MPO at this time? No, my son is insisting that he become my MPO, and I don't know how to tell him it is not necessary. What should I do? Ms. Priscilla, at this time, it is not necessary for you to have an MPO. And this is when I say, however, you can choose the person of your choice to be your MPOA when you are ready. However, you do need to put in place, what did you say, a care plan? You need to put something in place. Do you understand, Sarah? Sarah, do you understand? Your microphone's muted.
Yes. Yes.
Okay, so that takes care. You're saying, is that right? Yes, you can choose anyone to be your MPOA. The purpose of an MPOA is not to determine whether you need PALLA, palliative care, or ETHUNAISA, whatever, euthanasia. Okay, That's not what that does. That because that's what the patient's concern is, that the son is going to say, take her and put her in palliative care, or take all of the equipment away from her and let her die. But they're saying that this is not what that is.
Doctor, could you tell me how to pronounce euthanasia or euthanasia?
Euthanasia,
Euthanasia.
like youth in ASIA, euthanasia.
Euthanasia.
Maybe it's more like youth, YOU,
Euthanasia.
euthanasia, euthanasia. I think it's more like euthanasia. What other thing that you want to cover with that conversation?
No, just that's all.
Okay, so let's just go through it. Hello, I'm Dr. Priscilla. How are you today?
How are you, doctor?
I'm good. So
I am Mary.
okay. Hi, Mary. I
Hi,
understand.
doctor.
I understand. Thanks for coming in, Mary. As I look at your chart today, you're looking to discuss something about MPOA. Is that right?
Yes, that's right. I'm concerned about employee, and my son wants to be my MPOA, and I don't think it's necessary. Can you tell me more about that?
Yes, I can understand your concern. Do you believe you need an MPOA at this time?
No, my son is insistent that he becomes my MPOA, and I don't know how to tell him it's not necessary. What should I do?
Well, Sarah, at this time, it is not necessary for you to choose an MPOA. However, you can choose a person of your choice to be your MPO when you are ready. However, you do need to put in place a care plan.
Is that right?
Yes, you can choose anyone to be your MPOA. The purpose of an MPOA is not to determine whether you need palliative care or euthanasia. But now you should already know what this is, so maybe you should be asking what is euthanasia, I think.
Okay.
But either one, whichever one you ask, I should be able to tell you. So you can.
Okay, what is euthanasia?
Can you tell me more specifically about MPOA and ETHUNAI?
Doctor, I want to tell you that the sentence of the purpose of an MPOA is not to determine whether you need palliative care or euthanasia. It is relatively incorrect because it is um, um, I wanted to explain for you the purpose of MPOA. It is to delegate your authority to take medical decision to another one. So the person may have fears that he wouldn't be able to take palliative care, or he will may undergo euthanasia. So I think uh, it is this is sentence not I think it is not applicable. So
Okay, that could be. That could be. That could be. So just for clarification, this is not for your speaking. When my mother was sick with Alzheimer's and late stage dementia, she could not make any decisions for herself. When my mother went to the hospital for the very last time, they asked me, did she have a DNR, do not resuscitate, which is the same as euthanasia. And I said, no, she does not have one. And they asked, well, if she goes into a coma, do I want her to be resuscitated? And I said, yes. And I would only give them permission for euthanasia if I was there and I saw that she was in stress or something like that. So this MPOA, however you say it, I don't know how you would say it because I am not the medical person. It seems that this patient is concerned that the son may say, I don't want my mom resuscitated, or, you know, don't try if she's in stress, just whatever. But whatever the case may be, you just tell me what it is that you want to say, and then I will put it in the appropriate place. So here we are.
Yes, yes. The purpose of MPOA is to
The purpose of it.
delegate your medical decisions to another one who you can choose him. But let me assure you that's not euthanasia and refusing of palliative care is not included in this authority. This is my expression, if you can rephrase.
Yeah, I got it. Okay.
Yes, the purpose of MPOA to delegate medicine to delegate medical choices or medical decision, to delegate medical decisions to someone.
Okay, yes, you can choose anyone to be your MPOA. The purpose of an MPOA is to delegate
Medical decisions
okay,
to,
medical decision.
to someone of your choice. However, let me assure you, palliative care or euthanasia is not a part of the MPOA. That's right. Okay.
Okay. Can you tell me more about
Can you
MPOA?
tell more about? Can you tell me more specifically about MPOA and euthanasia?
Okay, and so to me, that looks like this would be the answer right up here. This is going to be your answer here.
Mm.
This is going to be your answer also. Okay, so I'm going to say, this is the doctor talking now. As I said before, you can choose anyone to be your MPO. Okay, you got that?
Mm-hmm.
Do you understand what I just did?
Yes.
Okay, then maybe the doctor's still talking. An MPO is a medical power of attorney. This means that the person can make any medical decisions about you. Medical decisions meaning that if your foot hurts, your son can take you to the medical doctor.
Mm-hmm.
And the doctor will listen to the son explain why you are there.
Mm-hmm.
My mother never spoke for herself. Although she could talk, she did not speak for herself.
Mm-hmm.
Okay. Anything else?
Yes. Last question. Should I explain that you will not able to make a further medical decision, or I like to warn her, or
No.
that there is I want to refer there is some of responsibility regarding this decision.
Well, the only thing that you're supposed to do is just let her know that the son can't do that, but you can suggest who for this plan of care. Let's see who you can recommend her to. Offer to prepare so you can offer to prepare an advanced care plan for her. That's all that you're going to do. So whatever
Okay.
she says, the doctor says, I would be happy to start a plan of care for you. Plan of care on your behalf. Okay. Thank you for coming in today. You're not even going to ask her any more questions depending upon your time. You're not in, the only thing she came for you, she didn't come for any medical reasons. She didn't come for any medicine. She didn't come for you to examine her. She came to ask you a question. So you've answered all of her questions.
Okay, Doc.
Okay. All right, Shady, I see that you're here. You have 10 minutes. You're just coming in late. Did you post anything already? Shady, did you post anything?
Yes.
Okay, let's take a look. See what you posted. My drive.
At Facebook, our group.
Yeah, I'm going there.
But as usual, I forgot to add title for the video.
You forgot to add the video.
No, title.
Oh, okay. All right.
Yes.
So just tell me what it's about then, I guess. Is this it here 8 minutes ago?
Okay, the same. I think the same. The professor gave the example when he was in high school. He was addicted to playing video games. He used to fail in chemistry. This caused him kind of discomfort and pain because he believes that in order to have a good career, you should be good in studying. So he started to change his mindset, his way of thinking about what he should be in the future. He believes that I don't know, I don't need to be a chemist in the future. I just want to be a sociologist. So he changed his way of thinking in order to relieve his pain.
Okay. And what was it that he was supposed to be doing? It was called, what was it? Some kind of disconnect? What was it? What was it? Social what? Shady?
It was a social, no, it's mental. It's kind of mental discomfort. A sociologist. You want to be a sociologist at future, in the
Okay.
future.
But the professor talked about something. What was this word? It's two words that the professor talked about. What are they?
Words?
This consonant?
Yes, yeah. The title is about kind of cognitive dissonance. Cognitive dissonance.
Okay, cognitive dissonance. Okay. And I know what that is.
You want me to?
All right. So what two things did you tell me that he needed to do? Remember, you're always going to tell me two things in the this is 45 seconds that you have to speak.
No, I have to speak 60 seconds.
Okay, 60 seconds. So you listen,
Yes.
you listen to the professor. Did you also listen to a conversation? Yes or no?
No, I just read the text and a lecture from the professor. I'm talking about his example. Yeah.
Okay. And what was his example? Tell me.
Yes, when he was in high school, he was not he was addictive to play video games. He was not good in chemistry. He wasn't study well, so this caused him some kind of discomfort, because he believes that in order to have a good career, he have to study well. So he started to change his mind. He changed his way of thinking. He started to change. To think what I need in the future. He just want to be a sociologist, and he don't want to be a chemist in the future.
Mhm.
So no good in chemistry. So he start to change to make an interpretation to the situation to reduce discomfort. He just want to be a sociologist and no need to be good in chemistry in order to relieve this discomfort or to reduce this gap between what he believes and what he should do.
Okay. So in this text that I read and listening to the professor, the professor actually described what social cognitive dissonance is. As I understand what the professor said is that when two things are not in agreement with each other, there is going to be discomfort. In the example he gave of a student that enjoyed playing games, but at the same time, the student wanted to have a career as blah, blah. But the student realized that he found enjoyment in playing games and decided to change his career choice because of the discomfort he experienced in not making the grades that were required compared to the joy he experienced while playing the game. Okay, so that would be 1 minute for me as I could kind of understand, as I kind of understand, as I understand what it is that you want to say. So tell me again, first, according to the text, the professor is explaining what cognitive dissonance is. Cognitive dissonance is when there is a level of discomfort between two things. One, you enjoy doing something, but you enjoy doing something else more, as was his example of a student in the class who knew in order to have a good career, study was required. In order to play games, which is what he really enjoyed doing, he was very good at it. So he had to make choices. The student decided to change his career and go into whatever it is that you said that he decided to do. Okay. So try to tell it to me. Since I didn't read it, I'm not really sure, but I do believe the word cognitive
Yes.
things are balanced. This is like,
Yes.
okay. So what?
Yes, yes, it's really kind of it's kind of a gap or imbalance between what we do actually and what we believe we should do.
Mm-hmm.
Yes, this
Right.
is a yes, this is the definition from the text. So I can tell you again.
Yeah.
Uh,
Tell it to me
yes,
again.
yes, the lecture is about cognitive dissonance, which is defined that it's kind of mental discomfort occurs when there is a gap between what we do and what we believe we should do, and we start to change our interpretations to the situation in order to reduce this gap. The professor gave example. It's about true story. When he was in high school, he was addicted to play video games. Unfortunately, he was not good in studying. He used to fail in chemistry. This caused him kind of discomfort because he believes that he want because he believes that he should have a good career, so that he should be good in studying. So he started to change his mindset, way of thinking about what he should be in the future. He changed his. He said that I just want to be a sociologist. No need to be. You need to me to work. Okay, okay, fine.
So you get the idea. And it's only like after the 35 seconds that you started to not know exactly what order you want to say what you want to say. You know what you want to say. You just have to keep that confidence that what you're saying is correct. So you're basically saying that after listening to the lecture, don't forget, because that your time is saying, After listening to the lecture, I realized that the professor was describing cognitive dissonance. Cognitive dissonance is when there are two opposing opinions, ideas, or concepts interfering with something. The professor gave as an example a person who really enjoyed playing social media, but also the student realized that he needed a good career. And in order to have a good career, he would need to study. So then he decided to give up one or the other. Do you understand?
Yes.
Okay, I would say practice some more. If you post it, I will look at it and I will give you feedback, Shady.
Okay, thank you.
I would also say, Shady, you have the same amount of time as everyone else. You post your information not at the beginning of class, post it before class. Then if I have time, I will definitely look at it and then we can talk about it more. But if you don't,
Okay.
if you don't send it, so you have 2 classes more. Okay. All right.
Okay,
I'll
thank
listen. I'll listen to what you post. Take care. Bye.
bye-bye.